Dr. Rob Rogers is a board-certified emergency physician with interest in medicine, education, and is one of the most popular medical podcasters in the country. He spent the summer of 2016 in the emergency department and traveling throughout the country and world as part of his education and teaching initiatives. Then, on July 29th, everything changed when he went from a doctor to being a patient with a potentially life-threatening diagnosis.
That was a day I was supposed to work at 4 p.m., so my wife was off, and we got the kids off to do their stuff, and we had some coffee. And after coffee, laid down in our bedroom to watch the news, and pretty quickly realized I had some heartburn. I really don't have a history of heartburn, so I got up, went into the kitchen, and like a good doctor, decided to ignore the symptoms for a couple of minutes. I'm like, it's going to go away, it's going to go away, it's going to go away. It never went away. And after this all was a span of probably about 5 minutes. And I think the clincher was that I remember having just incredible diaphoresis.
Diaphoresis is the medical term for sweating not associated with physical exertion or exercise.
After a couple of minutes. And I'm like, this is, and I remember my wife looking over at me after about 7 minutes and saying, we need to go to the hospital. So I was trying Tums, I was drinking milk. I'm like, it's got to be, I was trying to convince myself this has to be a GI problem. And over the course of minutes realized this is not a GI problem. So off we went to the hospital.
Rob's wife drove him to the emergency department at Baptist Health Lexington. He recalls walking into the waiting room.
I remember walking in with my wife. The waiting room was empty, which was amazing. It was about 9:30, 10 in the morning. And I sat down. I evidently looked horrible. My wife walked up to the triage desk and said, my husband's here. I think he's having cardiac chest pain. Then the funny thing is I remember the triage nurse looking over around the corner. And I remember, I don't know who said it, but I remember someone saying, that guy doesn't look good. And then I was brought back immediately to a room. It was incredible. I've never seen anything happen so quickly.
That's when things started to move quickly.
So they put me in a room. I got into a gown very quickly. An EKG was obtained within seconds, it seems like. There were probably 6 people, techs, nurses, an emergency physician at the bedside. And I kept kind of telling myself, this still could be reflux. It still could be something benign. It still hadn't hit me that there's something wrong here. So the thing that nailed it was after the EKG left the room with a person. I don't remember who had it, but as soon as they left the room, before the door even shut, someone else brought a box back into the room. You and I both know what that box is. That's the STEMI box. That's the box that goes with you to the cath lab. And I've seen hundreds, maybe even thousands of patients and never bat an eyelash that, here's the box, they're going to the cath lab, but this was my box. And as I looked at it, it just hit me. I'm actually having an MI.
To this point, the staff were unaware that Rob was a physician, much less an emergency physician who is accustomed to being the one assessing patients in his situation.
I said, can I see my EKG? She looked at me kind of funny, like, why do you want to see your EKG? And I think my wife had chimed in by that time that I was a physician. And so they handed it to me. And I remember looking at it, and it was the most classic, which is not a good sign to be a good teaching case. It was the most classic, best inferior posterior MI STEMI I've ever seen. And all I could think of at that moment was that this would be a great EKG to teach with, to share with people.
It was at that point that Rob was on his way to the cardiac catheterization lab.
It couldn't have been minutes. I was out the door to the cath lab, and I'm lying there on the stretcher. My wife is, of course, in tears, and she's trailing behind us. And it hit. I wasn't scared. My wife was petrified, and I actually wasn't scared for some reason until I got to the cath lab. And I know you've not been to the cath lab as a patient, but when the cath lab doors open up, it's like an operating suite, and there's a big table, and the screens, and the monitors, and the equipment is all laid out, and there were probably, I'm exaggerating, every time I tell the story, there's more and more people in the room. There were 50 people in the room. There were at least 8 to 10 people in the room, nurses, techs. I remember seeing the cardiologist come in, and they were everywhere, swarming about with their masks on, ready to go. And it just hit me. this cath lab is for me. I'm not delivering a patient to the cath lab. This is actually me. And it was very surreal to realize that this is the worst day of your life. This is your MI.
Rob was very complimentary of his experience at the hospital. He received a stent in one of the vessels of his heart and reports that the pain immediately went away when the stent was placed. He has been symptom-free since, but this is just the beginning. Now, Rob is making the changes necessary to prevent future issues.
I'm 45, which is really young. It's made me realize that my diet forever has just been total junk. And, I've not been eating right. I've not been I've already dropped about 9-10 pounds since, and I've got a ways to go. And this is years of buildup. This is the same buildup that happens to all of us over the years. You gain weight, you don't eat right, you don't exercise, and all of a sudden you realize you've got health problems. The diet has changed. I was initially depressed, realizing that, oh my gosh, look at what I can't eat. Look at the stuff that I can't eat that I was eating before. But then I started to grow and realize these are the things, and with the help of my wife, who's been incredible, trying to guide me through, well, this is all the good stuff you can't eat, and it doesn't taste bad. It's actually very good. So getting used to a diet is going to be lifelong, because I don't ever want to end up in the cath lab again with another stent. Getting the cholesterol down, changing the diet, exercising. The other thing is stress. It's they say hypertension is the silent killer, diabetes, all those things that are going on in your body, you don't know about it. But certainly, I work in the emergency department. It's a very stressful environment, and you don't have to work in an emergency department to have a stressful life. But that stress and that silent elevation in their blood pressure that happens all the time, those things happen over years. And then, you tip over the line, and suddenly you have a cardiovascular event. So stress management, whether that's meditation, I'm not really sure where that's going to go yet, but that's going to be a huge part of this. So honestly, it was a tremendous wake-up call to do the things to take care of myself that I should have been doing for years. My MI could happen to anybody. I remember the cardiologist talking about the fact that I probably had a 40% lesion. And some of the lesions are even smaller because they're actually within the vessel wall in the coronary artery. And those things are silent. I wasn't having any symptoms beforehand, and then it just popped. So in theory, that same process could be going on in a lot of other people, and they don't know it.
He also has a message for each of you.
This just was a usual Friday morning, having coffee. And I remember in the kitchen thinking, Rob, get yourself together, get yourself together. I said it out loud, get yourself together, there's nothing wrong here. And that was my MI. No warning, age 45. You don't want to be that person. And there are a number of things you can do to prevent from being that person. I didn't do them. As a physician, as someone who tells people to do them, I didn't even do it myself. Over the past couple of weeks, I've had plenty of time to reflect and look at, does this stuff actually work? I mean, we always talk about take your blood pressure pills, take your this, take your medications, take your aspirin. There's pretty good evidence that many of these things actually do prevent primary events, especially diet and exercise. So get your life together so that you don't have to be sitting here in this chair being interviewed by someone like you. You don't want to be that person.